The psychological burden is seen with an increased vulnerability to addictive behaviors as coping mechanisms. Moreover, almost half of the psoriasis and hidradenitis suppurativa patients, approximately 48%, smoked. So concluding, this article emphasizes on the need of addiction screening. Hello everyone, I'm Prajwal Pudasaini from Nepal. I'm one of the JEADV podcast moderators, and this month I'm delivering you an interesting JEADV takeaway. So Alexandra Jink and colleague published this pan-European study to assess the prevalence and patterns of addictive behavior among patients with chronic skin diseases in tertiary dermatology centers across 20 European countries. So by analyzing the addiction alongside clinical epidemiological profile, this study particularly aimed to deepen understanding of addiction comorbidities in dermatology. Chronic skin diseases including psoriasis, atopic dermatitis, hidradenitis suppurativa, alopecia areata, urticaria, and vitiligo affect a significant portion of the global population. And these diseases are oftentimes associated with depression, anxiety, social stigma, diminished self-esteem, and reduced quality of life. The psychological burden is seen with an increased vulnerability to addictive behaviors as coping mechanisms. This bidirectional relationship in skin condition and addiction is complex, and it involves both psychological and biological factors, but is not yet fully understood. Overall, the patient of chronic skin conditions demonstrate higher rate of addictions such as smoking, alcohol, drug abuse, pathological gambling, and internet addictions than the general population, with alcohol particularly being prevalent in psoriasis. So addictive behaviors such as smoking and alcohol are used as coping mechanisms by some, and it may further exacerbate these inflammatory pathways and affect treatment and their compliance. Furthermore, poor decision-making and reduced impulse control associated with these chronic inflammatory skin diseases further complicates the management. So, this study, which was a cross-sectional, multi-center study, was conducted for a year in 20 European countries in patients more than 18 years old with clinically confirmed diagnosis of one of these 6 diseases: alopecia areata, atopic dermatitis, hidradenitis suppurativa, psoriasis, vitiligo, and urticaria. So participants completed a standardized questionnaire which included socio-demographic and disease-related parameters. These were subjected to perceived disease severity, dermatological light quality index, the DLQI, and heuristic happiness. Validated instruments were used to assess all these addictive behaviors, and participants who reported daily smoking were classified as addictive smokers. So the results of this study were that among 3,585 participants who participated in this study had median age of 43 years, with more than half the patients, almost 51%, were females. Majority of these patients had psoriasis, followed by atopic dermatitis, hidradenitis suppurativa, urticaria, vitiligo, and alopecia areata. Median disease duration was 14 years with a subjectivity score of 6 and DLQI was 6. So the prevalence of addictive behavior was very notable, amongst which internet addiction was the highest, followed by smoking in a quarter of the participants, followed by hazardous drinking, pathological gambling, drug use disorders, alcohol dependence, and eating disorders. Moreover, almost half of the psoriasis and hidradenitis suppurativa patients, approximately 48%, smoked, and pathological gambling was seen among patients with alopecia areata and vitiligo. Significant association of addiction and chronic skin diseases were noted in male patients who were of younger age group, who were single, and also these patients had higher DLQI along with regional variation. So geographically, majority of these participants belong to Western Europe, followed by Eastern, Southern, and Northern Europe. Regarding the addiction in the EU region, addictive smoking prevalence ranged from 16% to 30%, which was highest in the Southern Europe. Pathological gambling was particularly prominent in Eastern Europe, and hazardous, harmful drinking was most common in Northern Europe. Addictive behaviors are prevalent in dermatology patients and are associated with socio-demographic and disease-related factors. And age showed an inverse relationship with older patients less likely to be engaged in addictive behaviors, possibly reflecting a generational difference in substance use and coping. Unexpectedly, employment was linked to lower addiction risk, which may reflect complex psychosocial dynamics such as greater work-related stress among employed individuals. Similarly, higher prevalence of internet addiction was seen among the younger participants. The study revealed notably high prevalence rates of smoking, gambling, alcohol use, drug dependence, and internet addiction, particularly among patients with psoriasis, hidradenitis suppurativa, and atopic dermatitis. This emphasizes the critical need for new approaches to dermatological care that account for addictive behavior. The overall smoking prevalence in this cohort exceeds that of the 19% which is reported in the general European population, which is particularly relevant for patients with hidradenitis suppurativa and psoriasis. Smoking's role in promoting inflammation in skin disease is very well established, and its association with higher DLQS scores in study underscores its negative impact. Moreover, the elevated smoking in Southern Europe highlights the need for targeted cessation program, especially in culturally entrenched regions. In contrast, the lower prevalence in Northern Europe reflect stricter tobacco regulations. So the DLQI was positively correlated with multiple addictions, such as smoking, drug use, and internet addictions, suggesting that reduced quality of life may contribute to maladaptive coping. There are several limitations of this study, such as absence of a control group. This study was particularly done in tertiary centers, and more important would have been the conduction of the population-based study with control groups, which could also implicate wider generalizability of this study. So concluding, this article emphasizes on the need of addiction screening and supportive mental health strategies which should be integrated into dermatological care, particularly for high-risk patients. Thank you.